Good afternoon. So we'll go ahead and get started here. So this is the last time that you get to see me, and then hopefully we can to move on. But we have a great conversation today. I really appreciate Dr. Deloria's comments earlier, and I completely agree with him that data are basically the new gold. And I think that is a really good precursor to this conversation. He also talked a lot about how Kentucky has a great data system, both our longitudinal data system with our KYSTATS partner, and also our post-secondary data system through CPE. But with that, data are only as good as how well they are used. And I think this conversation will really get to that, kind of where we're at, how data are currently being used to inform, the workforce or even programs, both the post-secondary and workforce perspective, where we are and really what else we need to do. So we're going to approach it from that angle. But we have a great panel today, I think, that really runs the gamut of kind of stakeholders in the data and decision-making area. All the way from post-secondary to healthcare industry representatives, and then also kind of that liaison at KYSTATS that has one foot in both worlds. So with that said, I'll go ahead and introduce our panel. So first we have J.P. Ham. He's the Associate Vice President for Workforce Development at the Kentucky Hospital Association. We also have Dr. Beth Kelly, who's the Research Director at the Kentucky Center for Statistics. Dr. Rick Jones, who's a Senior Statistician at KCTCS. And Dr. Charles All, who's the Executive Director of Center for Policy Research at the Kentucky Chamber of Commerce. So like I said, we have a great panel, and hopefully we can have a great conversation around kind of the data environment and where we're at and where we need to go. So with that said, I'll go ahead and get started. So this first question is going to be to Rick. Congratulations, Rick. You got drawn for the first question. But as we all know, KCTCS plays a critical role in workforce development through training and education. So how has KCTCS partnered with employers and industry leaders to both gather workforce data that can inform curricular development, but also address skills gap, specifically in healthcare?
Yeah, so we do a lot of partnership building at KCTCS. We're kind of in between the workforce and post-secondary education. So we provide all kinds of technical training. And because of that, we're deeply connected to the economy. And so naturally, because of that connection, we collect all kinds of data related to workforce. Probably in terms of partnerships, the thing that's been kind of emerging and growing recently is a program called TRAINS. And it's run through our Workforce Solutions Department. And essentially it is I think of it as almost like a couponing system where we provide up to 75% tuition reduction to employers who are interested in providing workforce training to their employees. And so that program has been growing. We had more than 100 new employers join TRAINS last year. I think it's 226 employers came back to us again, and so it's more than 300 total employers that we're working with. And so I think KCTCS contributed over $7.5 million to that program, and the employers contributed another $3.5 million to that program, and so it continues to grow. We have a new president at KCTCS, Dr. Ryan Quarles, and he's very focused on workforce education, and so continues to talk about the benefits of TRAINS, and within that program, we're working with employers and trying to make them aware of what we do, and so we use data throughout that whole process to kind of tell our story.
Yeah. And just to kind of back up a little bit from more of a, say, 40,000-foot view, how would you say at KCTCS or, within the system, you all leverage workforce data? So say in your current role or just as a whole, what say data sources do you use, and kind of what does that look like?
KYSTATS a lot.
Yeah.
We use KYSTATS a lot. One of our probably, I would call it almost the gold standard of employment data at this point is called unemployment insurance data. And so we use that a lot. And so that allows us to track our students after they leave us. And so we can see, what's the value of a particular program, not just maybe 1 year after they leave, but over a long course of time. Because a lot of times, especially with community college degrees, it takes a little bit of time for those programs to kind of generate the return on investment that we hope to see. And it's just a process of gaining that experience for our students. So, KYSTATS is another one that's big for us. We use the multi-state report a lot. We use the post-secondary feedback report a lot. And all of that is kind of used to kind of tell our story, what we do and how well we do it.
Perfect. Thanks, Rick. And kind of moving away from the post-secondary perspective, I have a question for you, JP. So I know KHA uses a lot of different, data for your decision making within your organization. So how does KHA use workforce data to identify shortages or critical needs? And I know we've talked a lot today about Appalachia and kind of the rural areas in Kentucky. So how do you use data to kind of identify gaps, say, within those rural areas?
Thank you. We do. This is working here.
Yeah.
We do annual reports. We have our own excellent data team. I'm not just saying that because my boss runs a data team, and my other boss is sitting right there in front of me. But we have an excellent data team, and each year we put out a report. I'm going to kind of lean forward here a little bit. And now that is restricted to hospitals, to our members. So we get a piece of that type of data. We break it down according to ad district, because if we break it down any further, it would be too much of an identifier for some individual hospitals. And so we're very protective of that. But then to dig down deeper, we have some strong partnerships. So two of the strong partnerships are sitting at the table back there. So one is our chamber. We have a partnership with the Talent Pipeline Management that Sarah Tracy is my lead go-to with that. We're divided into 4 regions. And so what that does, that allows them to go into the different regions and dig a little deeper and let the hospital share that individual information and then convene and connect with the folks. So, and that's not just convening and connecting in rural groups, that's convening and connecting throughout the state. So like Health Force Kentucky that has a truck out there, that's just Western Kentucky, but we brought that to our convention last year and brought a ton of attention to how good that program is, even though it's just regional, rural, but only in some counties in rural Kentucky. I think the other partnership that I'd like to point out is with licensure agencies like KBN with Kelly Jenkins, because we're able to do a really deep dive with the data that they collect. So like I said, our data is just for hospitals, but then when we work with agencies like KBN, we're able to get the larger picture because the hospitals work with the long-term care facilities. We work with other groups and agencies, and those are very strong partnerships. And what's great about their data, because sometimes it gets misreported, is that I'm just doing these numbers off the top of my head, although I did write down some notes, but I won't try to find them at the moment, is that there may be 70,000 licensed nurses under KBN, but from the standpoint of nurses that are actually practicing, it's more like 48,000. So if a report comes out and says we have 70,000 licensed nurses, that is not accurate. That has retirees, people working in insurance companies, just people who are working out of state but maintaining their Kentucky license. And so that breakdown is huge, along with being able to do projections based on age and demographics.
Perfect. And just to follow up on that question, so kind of outside of the primary data collections that you do within your organization or within kind of the existing partnerships or the partnerships that you all have, do you use any national data sources or maybe state-specific data sources that you use for reporting or decision-making, or do you mostly rely on kind of primary data collection?
We mostly rely on our own data collection. and Mike Schutze and would be able, who's our director for data, would be able to answer that question a little bit better than I. But sometimes that data is so generic over the type of occupations, like what mental health is, that's really not enough of a breakdown. Or reports come out that we're better than average, but every state is having issues, so we may be better than average, but we're still struggling, although we're doing a lot better, as Nancy will be presenting at the closing remarks.
Perfect. Thank you very much. And Charles, so kind of in that same vein, really curious about the Chamber's perspective, when it comes to workforce data and how you all leverage workforce data. So how important is workforce data in building strategic partnerships, both with educational institutions and healthcare providers to address workforce shortages? And I'll go ahead and kind of give that same question to you. I'm curious kind of what does your analytical landscape look like at the Chamber? Kind of what are your sources? What are your go-tos when it comes to doing things like creating partnerships, but also kind of looking to see where these gaps exist and where your organization needs to put its efforts?
Well, first of all, thank you all for having me. We appreciate the opportunity to get a chance to talk with you all. I spend a lot of time looking at Kentucky's general labor market. We do spend time trying to be industry specific, but oftentimes if you look at a lot of the research the Chamber has produced, we try to talk very broadly about the current health, the current state of our labor market. I do think healthcare, though, is one of those areas where we try to be a little more sensitive to it. If you think about the shortage of, I'll just use like baristas as an example. I don't want to diminish that line of work by any means, but if there's a barista shortage, that's really inconvenient. It's really frustrating. It might make us late for work. A nursing shortage works very differently. That has a very different type of impact on us. And oftentimes when I'm having conversations with people who maybe are a little skeptical of the labor market situation as we describe it when we talk about a shortage, I kind of remind them of, think about what that's like when you go into that ER and they're short staff. What does that mean? And so I do think this is a particular area where it can literally be life and death. And so I think healthcare in particular is a place where we need to be extra sensitive to it and put even a little more elbow grease than we normally do into solving that particular workforce challenge. And data is just absolutely critical to that. I think that our post-secondary institutions, including the great work that CPE does, is really important in terms of helping to kind of making sure that programs are meeting demand. And that's one of those places where I think data plays a really key role, because you can shoot in the dark. We can suspect we need X amount different types of degrees out there, different types of healthcare workers, but having a level of precision is really, really important. And as JP was talking about, that's the heart in a lot of ways of our partnership with KHA through our TPM project, our Talent Pipeline Management project, where we do try to work directly with industry to think through what are your actual needs, how do we project those needs, and then what are the actual skills that we need to do. But you need data to align all of those things, which of course requires a lot of conversation. I think KYSTATS also does a really great job in working through a lot of these industry demands. With TPM, we can get a lot more granular and really dive into the details of what are the exact skill sets. And that also works the other way, where we could use data, CPE data in particular, to understand what institutions are producing the types of skills that maybe healthcare employers need at that time, and then we can create those alignments. The other place, though, where I think this is extremely important is the role of data in measuring progress. We need to make sure that we have this stuff set up on the front end so that we're actually measuring our progress as we go. And of course, data is going to play a really key role in that.
Yeah, absolutely. Thank you. And Beth, welcome. So there's been a lot said about Kentucky statistics, or KYSTATS, and rightfully so. I think you all play a huge part in both kind of the gathering, aggregation, and delivery of workforce data. And you are really that transition point, both from secondary to post-secondary and then post-secondary to the workforce. So with that said, curious how what does that look like? How does KYSTATS collect, analyze, and disseminate workforce data that, say, institutions like KCTCS or KHA can use? And just kind of curious what that process looks like and kind of where you all fit in to that role.
Sure. Again, just like Charles said, thank you for having me. So a little bit about KYSTATS. We sort of have two parts of our office. One part is we maintain the Kentucky Longitudinal Data System, and what that amounts to is linking data across agencies throughout the state. So one of our great partners is CPE. We also partner with unemployment insurance and Department of Education, KIA, CHFS, and we link data across these agencies. So, for example, I would appear in the data. I would appear, if it went back that far, I would appear as a student at UK. I would appear as an employee of Berea College. I would appear as a mother from Vital Statistics, and we can link across time. So one of the great things that we can do is take students that are graduating with different degrees and then look at where they are employed. Look at what industry they're employed in. So for example, they could be employed in the healthcare industry, and so we would be able to identify them. And then say someone wants a special request, wants to know about students that are graduating from KCTCS and wanting to know what do they do, what industry do they work in. So they can ask us, and then we will, aggregate data and pass it on, or we will do something like come up with, a post-secondary feedback report, which will take credentials, people that are credentialed, and then look at what industry they work in. Or, we can look at this by credential type, by major, and so forth. So that's one aspect where we are linking across, say, post-secondary to the workforce with unemployment insurance wages. The other part of our office is labor market information. And with labor market information, probably the thing that you would recognize the most is that the unemployment rate comes out of that part of our office. But it also includes occupational information. So that would include wages by occupation, median wages, and then it would also include projections of employment. And that would be by occupation. So you could look specifically at healthcare. We have workforce in general. So that might be the number of exits, the demand, are the amount of people employed with that occupation going up or down, and that would be based on the current economic situation. Of course, we know things change, but part of what changes is policy, and so someone might look at these different numbers about the projections of the employment and then do something with policy related to that. As far as how we disseminate this, we might have dashboards that are public-facing. Rick mentioned the post-secondary feedback report. We also have a multi-state report that links across states, both post-secondary and wages. We have public access files underneath these that anyone can go access at any time. We do special requests, so data requests. We work a lot with partnering agencies. We work a lot with these guys. We talk to them a lot. They're one of our best friends. Our mission is really to provide data to our practitioners, policymakers, and just the general public of the Commonwealth. So anyone at all can come ask us for data at any time. And I encourage all of you to do that. And we really like to help support any of the workforce with the data.
I think a lot of this conversation is around partnerships and kind of how those partnerships are created. Can you speak just a little bit on kind of the process of kind of the partnerships that KYSTATS has, kind of what that data collection process looks like, and how you go about kind of maintaining those relationships, those partnerships, and to be able to do like what you just said, to be able to provide those data, to the public.
Sure. So we, first of all, we go to our partners or maybe we need a new partner. One of the gaps really in our data is healthcare, specifically because we've got conflicting federal laws, HIPAA and FERPA, and integrating them. And so one of the things that we want to do, healthcare practitioners are really interested in linking this data. So we might try to approach, or someone will approach us and say, can we link our agency's data into your system? So we go about creating a data sharing agreement, and then there will be a secure way for them to transfer the data to us. Our developers take that and they match to different people in the system. This is about linking across agencies. And then they wipe away all the PII, the private information, so that then the researchers that are then working with that data never see a name, an address, a social security number. And thankfully, I don't want to see that information. I don't want to accidentally give anyone's information away. So then at that point, the researchers take it that don't see any of the information and then fulfill these requests.
Perfect, thank you. And Rick, a follow-up to my previous question. I'm curious how you use, or within KCTCS, data are used to, say, advise programming decisions. So, you know, say new programs, program reviews, what programs to keep. And I'm assuming that has, you know, something to do, or has a lot to do with kind of workforce demand and how KCTCS kind of, what kind of, I guess, incentive programs are around things like high wage, high demand, or even specifically healthcare, and holistically how data are used kind of for programming purposes.
That's a good question. So we use data in a lot of different ways. So we also produce reports that are around the issue of data linkage. And so we have two things that I kind of work on. One is a GIS. And so in that program, we use location is the thing that we use to link data that aren't normally linked together. And there's a lot of advantages to using location as a way to link data. We also have another tool that we call the program alignment tool that we spend a lot of time with our colleges trying to understand how those programs align to the occupations that they are supposed to align to based on skills. And so we take that data and use it to also make linkages between our programs and occupations. And so within all of that, there's a lot of collaboration that occurs between us and our colleges. And so we do our best to try to evaluate our programs using that kind of information that we're collecting from folks who are on the ground. And so a lot of times that means as we think about creating data products, say, we need to get in the same room or virtually and with folks at the beginning and to understand what they need in terms of a review of a program in terms of its value, and then also to kind of at the beginning conceptualize what we mean by things like value, because we have a lot of programs at KCTCS that don't necessarily lead to strong wages. Like the one I always point out is childcare workers. The wages in childcare are pretty tough, but we saw during COVID the effects of what happens when you don't have childcare workers available to you. It affects nurses, and so and their ability to get to work because they have to do something with their children. And so there's a lot of things like that where getting ahead of it in terms of defining what you mean by, say, high wage, high demand, or value. Yep. What do you mean by high demand, high value? And so being clear about those definitions, and then working from those definitions to try to figure out how you operationalize it, so how you take it to measurement.
Yep. Perfect. And, kind of to work off that, I think having such a rich data system that we, it offers a lot of opportunity. And one of those opportunities is to be able to operationalize things like that, to look to see, like you said, definitions matter. So how to define high wage, high demand, kind of what is important, and data plays a big role.
Yeah, I'll go back to like research methods classes and stuff where you learn about operationalization and conceptualization. We won't get too far into research methods. And, those sorts of things and those questions. But that stuff matters, with how we measure things and how we think about things.
Yeah, perfect. Okay, coming back to you, JP. So curious, what role do hospitals play in providing data? And I know you talked a little bit about this earlier, but also, how can these data be used to improve recruitment and retention strategies in healthcare?
I think the One great example was, although I missed, I came into the tail end of it, were all the big checks that came out. So that's part of our.
I apologize. They didn't give me any big checks to give you guys.
But that was, that's our advocacy team, Nancy, Jim Musser, that they lead. So that was, they were one of the supporters of House Bill 200. So that data leads to those types of legislation that then leads to that type of money being distributed, and also attention to the healthcare industry, like you were saying, that nurses can be more important to than baristas out in our local Starbucks. A lot of it is, again, going out with our talent pipeline management folks. And one thing I failed to mention is when we do the convening and connecting, it's not just communication, but Sarah and our web person created an asset list that's on our website now. So anybody can look at that across the state and look either regionally or statewide and see, oh wait, there's Health Force Kentucky and Western Kentucky. And now this would be a good idea to expand into other areas. And it's not just rural areas, but when Sarah and I presented with someone else in a Louisville group, they saw a huge need for it in the urban areas. So like JCPC is not creating 20 different labs, but they could maybe share the bus. I think the biggest thing is for improving the recruitment and retention is just the communication within the communities, is that, like Jim Musser likes to say, hospitals bring in more money or biggest economic drivers than bourbon and the horse industry combined. So I think that's just that could be healthcare in general, but it could be hospitals. Nancy can correct me later on that piece of it. But not all local high schools, I know this is CPE, but we need to work with the local high schools, because not all high school counselors understand the hospitals as being employers, that you have to be a nurse or a doctor. And a lot of what really helps are these feeder positions. So you can go in, and I said this during a meeting yesterday, you can go in with a feeder position. Now, ironically, that could be a barista, or it could be a transport person, but they get into the system where then it's tuition assistance. And there's a story from one particular hospital where Jacob and I were in Southern Kentucky, and they talked to someone who just didn't know what they want to do in high school. They're a transporter. And all of a sudden I think they fell in love with the laboratory, and then through the tuition assistance, they became a lab tech professional there. So it's all that cooperation together. It's really looking into that, but it's also recognizing that hospitals tend to be the largest employers in the community. And if we at least get them into the system, that will, even though it may be someone that's not in the healthcare, some of our, I'll add one last thing, about 45% of hospital employees on average are not in healthcare. It's HVAC, it's security, it's all these other positions, accounting. So as one person said, if your student's really good at math and science, but they faint at the sight of blood, she was the CFO, send them our way, because if they can do math, I really need good accountants.
Yeah. No, and kind of to piggyback off some of your comments, JP, to Charles, from a policy perspective, I know the Chamber does a lot of advocacy. So how does the Chamber use data, say for advocacy or policy advocacy, and specifically when it comes to high wage, high demand, or high need areas, and specifically healthcare? So how do you all leverage data, I guess, to kind of have that policy conversation or to do it effectively?
Data can be used so many different ways. When you think about, we were talking about measuring performance earlier, being able to operate with precision. But I really think another very important role that good data can play is storytelling and narrative building and helping people understand trends over time. And that's one of the key ways that we do it. At the Center for Policy and Research, we produce a lot of reports, we produce white papers, all sorts of different things. And more often than not, what we're really doing there is storytelling. We're helping policymakers understand trends, understand how things came to be. I think a good example of this is back in 2021, we produced our big report on the state of Kentucky's workforce. We called it 20 years in the making, Kentucky's workforce crisis. And one of the reasons that we felt that that report was so important at that time was that coming out of COVID, we had a lot of people that were very interested in labor market challenges and workforce challenges at that time. And we often heard occasionally, particularly in media, this notion that this thing just sort of emerged out of COVID, or it just kind of came out of the blue. But if you look at workforce data, if you look at things like workforce participation, for example, over the span of 20 years, and you just read some of the empirical research that's out there, we knew this was coming. We knew that that was coming. What COVID did was really just accelerated a lot of long-term trends. And the reason that that is so important in helping to kind of tell that long-term story using data to kind of help illustrate that is that it pushes us to think far more creatively than we were probably thinking at that time. Where if you were looking at that challenge as something that emerged out of COVID, you were not seeing the forest for the trees at that point. You were looking far too recent. And when you start looking more long-term, you start grappling with this huge demographic shift that is shaping our country, where we have this aging workforce, we're having fewer children, and the effects that that has. And so you have to start getting really creative once you understand that story, and you have to start thinking much more innovatively about how you're going to go about solving it. So I really do think that the storytelling component to data is one that can often be overlooked, but it is so, so important when it comes to advocacy. I would say the other thing that I think it's very important for is when you are requesting limited resources, for example, from the state budget, or if you're requesting resources from philanthropy, you need to be operating within the realm of precision. And data is going to allow you to operate with that precision. So if you go and talk to the chair of House Appropriations and Revenue or Senate Appropriations and Revenue, and you think, well, we want to solve X problem and we think it's going to cost X amount of money, you're going to need to show the proof in the pudding on that. All right, you're going to need to show exactly how much you need to accomplish X and what that return on investment. And data is going to center around all of that. And so if you haven't done that data work on the front end, if you haven't made that investment, whether that's time or financial on the front end, you're setting yourself up for a lot of failure at that point. So it certainly serves multiple purposes in the advocacy phase.
Perfect. Yeah, and I actually stick with you, Charles. I know, and this is really for all the panelists. We've talked a lot about kind of what we use, what's out there, what the current landscape looks like. But I'm really curious about the opportunity. So where do the gaps exist when it comes to data that you need that would help you do your job? What maybe new partnerships that would really be beneficial in the work that you do to try to bridge those gaps and fill those employment gaps. So, I really want to transition to opportunity. So Charles, what do you see as the biggest opportunity, or where do the gaps exist in when you do your analysis, and what would be helpful going forward?
Well, first of all, I'm gonna take a quick liberty here to just praise the important role of unemployment insurance data. Beth and Roderick both brought that up a few minutes ago. It's kind of the unsung hero in a lot of ways of a lot of really good workforce data analysis, and we don't think of the role of unemployment insurance data in that way. I think what Beth and her team is able to do with unemployment insurance data on the back end is really, really useful. A lot of that publicly available data, though, is really useful too. Thinking back to, say, August, back in early September, we got a really nasty August jobs report that kind of sent shivers down the spines of lots of folks who watch the labor market closely. But if you're somebody that also takes a close look at unemployment insurance claims and use that data, you can kind of check a lot of those concerns and realize, like, well, there's not really much uptick in these claims. Maybe things aren't so bad. Lo and behold, we get a September jobs report things looked a little bit better. But that, I just want to mention that real quick. It's sort of an unexpected data source that could be really, really useful. If I could point out one thing in terms of opportunities, I mean, you talk about opportunities, kind of go back to challenges a little bit, right? Definitions. Shared definitions, I think, is so important because we have a lot of data sources. You know, I recently did some work around housing recently. We just produced a big report on housing, and there's a bunch of different housing data sources. You know, some things coming from HUD, some things coming from the American Community Survey and Census. They're all using different definitions, and that can often make things really difficult to reconcile. And then when you add on to that, you know, those are government sources right there. You would anticipate government sources would primarily be using pretty darn similar definitions, but when you look at individual institutions that are gathering data, they're potentially going to be using different definitions for very, very similar things. And so the more coordination that can take place between entities that are gathering data in a certain sector, in a certain field, whatever it might be, but to coordinate your shared definitions. And then if I could just add on top of that, communicate those definitions clearly. I can't tell you how many times I've had conversations with folks, whether they're policymakers or just the general public, where we will talk about unemployed individuals. Unemployed individuals often get confused as folks who are just not working at all and not looking for a job. Well, that's not really what an unemployed person is technically by using the definitions. But it's a good example of where there's sort of, when you think about data literacy, I think it kind of starts with definitions. Understanding what these terms means, but then also having shared definitions amongst folks that are gathering and analyzing data is just absolutely critical.
Perfect, thank you. And same question, JP. Like in your role and your work, where are the gaps and where do you see the opportunities?
I wrote down 4 things, but I'll be quick. One is, like I already alluded to, is the consistent, deeper data from the different licensing boards. That would be extremely helpful there. Like I said, we know where a hospital may need respiratory therapists, but we don't know the overall need with the partners. And I just may have used that just out of an example, but so no offense to that particular board. That's just the first allied service that came to mind. The other is building the partnerships with the schools. I don't know, I won't make eye contact because I know the school's here, but they took our data and they compared it to their school system and where those school deserts are. But again, that was our data for hospitals. So some of our percentages, when you look at our latest report, the percentage may be really high, like there's a 20% shortage, but there's only about 300 positions needed. So how does that work with schools? That's one particular system. But they were able to overlap that data, and now we're going to go to the next step to see how can we build those school programs to be able to help. I think the other thing is we are not the only ones with the labor shortage. Like I said, 45% is you all use non-medical. I came from Louisville Metro before this, so across the board, yeah, we had EMS and public health, but we also needed mechanics and so forth. So everyone is screaming at the legislature that we need more help. And the interesting thing that segues into the last point, and that's that projections report that we did with the Board of Nursing, is that what's scary there is that the working population, as it's defined in the report, 18 to 64, is going to stay stagnant, flatlined until 2035. But in 2035, our population, 65 and older, skyrockets. So from a healthcare perspective, it's a double whammy. That means that we are losing our folks to retirement, and statistically speaking, they're going to be returning as healthcare patients. And that's a double whammy that we don't that other industries may not necessarily have, although we do need more daycare centers to then get more people back to work. But that's one of the bigger issues. And again, that's where it's helpful to have that deeper data.
Perfect. Thank you very much. And quickly, Beth, just what would help you do your job to kind of provide data to stakeholders? Where are the limitations? What can make things better?
So I want to echo what Charles said about definitions. That is one of the things that makes our job really difficult, is to be able to have common definitions across data sources. And I also want to talk about the gaps in the data. A lot of health data, because of that HIPAA versus FERPA, that gets messy. But we just recently had a board meeting in which we talked about a lot of these issues or opportunities, and one of the things that came up was actually getting licensure data that would, help inform others quite well. So on a very specific level, everyone always wants to know about the occupations that students are earning after graduation and what credentials are actually leading there. And that is data that we do not know. We do not know occupation from the unemployment insurance wages. So that gets really difficult. What we do know is industry. So what JP was saying is that when you have a hospital, 45% of them are not actually the doctors and nurses and so forth. But also you could have nurses that work in a school. So all we know is that they're in education. So that is a big issue for us.
Perfect, thank you. And last, Rick, what at KCTCS, what gaps exist, what opportunities, what would allow the system to be able to better serve students, to get them into the healthcare industry or high wage industry, and get on the right path from a program perspective?
I was actually going to say the occupations missing from the UI data. That's a big issue.
We
for
need
us.
enhanced UI records.
Yeah.
That's what I'm getting.
Well, I would go a step beyond that. Even not just enhanced records. It would be nice to have that. I mean, it would change everything for us in a lot of ways. But doing more with the data. So doing less description and more analysis with the data, I think would do a lot for us. I think the UI data has a ton of potential for predictive analytics that we don't really take advantage of very much, but I think it would be very useful. And then the KYSTATS longitudinal data system also would be very useful in that way. So sorry to kind of repeat the same answer, but that is a real big gap.
No, if I didn't agree with you so much, I would be upset.
I guess one other thing I would say is using the UI data in a little bit more of a creative way, beyond just, this is the percent employed, these are what their wages are, and so on, but using it for other measures of job quality, I think would be a very interesting thing to do. So how many employers do people have? So if you have one good employer and that one employer is providing all your wages, that kind of indicates it's probably a good employer. But if you are earning your total wage for a year or quarter or whatever it is, and it's through 5 employers, then it's probably an indication that you don't have the greatest job. And so that's another way that we can use that information to evaluate our programs.
Perfect. Yep. And so it looks like we're at time. I promise I didn't plan it for it to be exactly right, but it looks like we did it. So just want to thank our panel here. I know that, this is an all-star panel. Literally, these are some of the best data leads in the state. So honored to be on stage with them. I do work with them very often, so they're probably tired of seeing me by now. But thank you for listening. I think the data conversation is a very important conversation, and hopefully we can continue these conversations to kind of bridge those gaps and make sure that we have the data needed to make the right decisions, from both a post-secondary and workforce perspective. But if you so thanks again, and if you just give our panel a round of applause.